I am now going to open us up to the Q&A. There were some questions in the Q&A. First, any chance that this could come to Ohio?
I would just say we are very committed to disseminating everything and, you know, anything that we could do to help, and hopefully Ohio can find, you know, some inspiration from what the Fresno community has been able to do. We're happy to help.
Awesome. And how is adherence to the treatment? What are the barriers to consistent attendance of the sessions? And has this improved since the treatment has shifted online? Has it been easier for women to get, make these connections?
Bobby, do you want to take that one, or would you like me to do that?
I think it's kind of what Brittany mentioned. You know, there's been ups and downs in terms of women being more comfortable because they don't have the transportation issue perhaps to access sessions because they can join in a phone. But then there's a technological concerns and the privacy concerns of where do I go to have a, you know, private group session with other moms. So I think it's like there are some things that have been good, and then some other things that have also come to the surface for us to be mindful and address as we move along.
Some other questions are those participating in the study who received either individual or GLOW services able to receive additional supportive services as well outside of the study, or was it exclusively the individual care versus GLOW?
Do you want to take that, Fabi, or do you want me to?
I don't know what additional services they were referencing, because I'm thinking the individual care program, the CPSP, provides some services to participants. It's just the main difference is it being an individual prenatal care versus the group prenatal care. So if you're a participant of GLOW, you get those wraparound services. If you are a participant of CPSP, then you get those services. I'm not sure if.
Yeah, and a lot of these are community services like WIC and, you know, and psychological service and so forth. I mean, one difference is those are brought, again, when the groups were happening in person, then representatives would come to the GLOW meetings to make sure and to help connect the women to the services. But these are services in the community that anyone has access to. And I would just say in the GLOW group, though, they did get the additional you know, food to take home, transportation to get to the meeting, on-site childcare, and that would not be something that would normally be a part of care for the others.
Great. And then how long are the GLOW group meetings, and when do they meet?
So there's between 8 and 11 sessions. They're about, you know, this is pre-COVID. There were between 90 minutes to 2 hours long. And usually the first 30 minutes would be time to have one-on-one check-ins with your provider. And then the middle part was everyone in the group conversation and group setting. And then allowing the last 30 minutes for anybody that might have come a little late to have that individual check-in with their doctor. And they happen, and there are 8 to 11 sessions, because as you know, in pregnancy, you start meeting a little bit more often once you're getting ready to have the baby. And then there's a postpartum session as well.
Great. And then a couple more questions for how did you address the access to technology issues? And Brittany, you mentioned that, you know, that that was one of the concerns that people were helping out with. But service and device problems or lack of tech skills, were there specific things that you guys did to facilitate that or make that easier?
I think we're in the midst of trying to figure out how we're going to address the technological issues based on the feedback that you heard from Dr. Chambers.
Great. Any other questions people have? Oh, one other question was, how are you engaging with clients during these trying times of COVID-19 pandemic? And you guys have talked a little bit about that, but is there anything else to add on that? No.
I know one thing that was important from my data collection, and that's also like talking with the women, talking with the first 5 facilitators. And I think the questions that people are asking, so GLOW is currently still providing space for women to meet, to engage, to get information, but are still in the process of adapting it to be group prenatal care. And so now it's kind of what we've been pulling around as a team. It's kind of almost working like a support group at this moment. And GLOW facilitators and first 5, we've been working really, really hard to make sure we're addressing all those things. And first 5 has done an amazing job at contacting other agencies to see how they can get access to like tablets, computers, in ways that that can be loaned and then can get them back to continue to distribute to other people. But it is still in process. And we have had focus groups with women who we did interviews with to really talk through the curriculum to see like how much time would they like to spend in a session. And so we know they're like, no, not 2 hours, thinking about a 90-minute session. They also told us like, what are some key things that they really need and want, particularly in an online format. And so First 5 is currently working on revising the curriculum to meet the needs and demands that we've collected from all of these stakeholder groups.
I think I'll just add that some of the things that we're also finding is medical providers are also trying to figure out how to best do telehealth in a group setting. You know, some of them might need a laptop because they don't have one with a camera per se, where they could, you know, have these types of conversations with moms. But we are like Dr. Chambers mentioned, we are exploring perhaps access to a location where moms could come to have a private space to log into a computer and be part of the group session, or maybe low cost internet, you know, cards that moms could have and devices that we could lend. All of that is all starting to come up to the surface as ways that we would want to figure out how to continue supporting moms, because you heard moms, because your social support continues to be top of mind for them, even more so now.
Great. I have a couple more questions here. One is, are there any new numbers from 2019 in terms of infant mortality rate among Black women? Have you seen any decrease from that 2009 to 2013 period?
Yes, thankfully so. The numbers as of July 2020 are that the infant mortality rate is down to 10.97, which is a huge decrease. But when you compare it again to other groups, it's still double what the rate is for other ethnicities. And so it is decreasing. And I just, you know, what we know from our talks with Black infant health volunteers is they feel there's a tremendous benefit from the supportive aspect, from the way that they provide client-centered life planning, that they do case management. They also host groups. And so it's been, again, another way for them to feel supported. And really, when you look at the data and you look at the graph, you may be leaping to say that there's a correlation, but what we know is that when the funding decreased dramatically, that the rate skyrocketed, and it just was hard to ignore. And so one of the things that First 5 did was to advocate for increasing that funding, and that was extremely helpful. And Fresno's Black Infant Health is one of the most recognized in the state for the effectiveness of their programs and just the patient satisfaction. So I just referred someone not too long ago, and they just texted me and said, I just got a doula and I'm so happy and I feel less isolated and more supported.
Great. That actually leads to another question that we had, which was, have you partnered with doulas in the community?
Yes, so there is work going on with the Department of Public Health around perinatal equity, and one of those projects will be introducing doulas. And then one of the health payers or health programs, Anthem, is now covering that service for women. So there's a dipping of the toe, and we are seeing that expansion, but we're hearing how effective it is from the perspective of the patient.
Great. And I think I will make this one our last question of the session. We would like to know if you have any support for significant others or spouses in both individual care and the group settings in this study.
Trying to remember, I want to say that in the postpartum sessions, we have involved partners, because it comes up and it's one of the topics of conversation for women. So we have done what we can with the help of our facilitators to engage partners as best as possible and make sure that they have a space also.
Yeah, I could also add that part of the it's still adds a layer of support. It's not technically connected with Embrace, but there is part of the peri-equity natal funds are going to talk about fatherhood and supporting some efforts to engage them in a more intentional way. And so there's a lot of great energy around this particular issue, really pulling in partners that you don't necessarily think about. And so that's part of the exciting work that is happening here on the ground.
Great. Thank you again. I just want to echo just a huge thank you to all of you for sharing the study and for being here with us today. I'm going to turn it back over to Karen to conclude our session.
Can I say one more big thank you and shout out to our talented panelists? I don't know if you were following the chat, but there's a lot of just hype. People are giving you virtual applause and everything else in the chat box saying thank you so much for this information and sharing, especially about the modifications during COVID-19. People are so excited by the work that you're doing. So thank you so much. For those of you who are able to join us, that includes our speakers. If you're able to stay, we understand your time is valuable. We would like to just open this up to an after party. We have several panelists involved today who are patient partners on a number of our research projects. And many of us wear dual roles. If you see myself as researcher patient, we have patients and advocates and a number of roles. If you could join us to our panelists by turning on your cameras and having your mics ready. Great, we'd like to extend this conversation. And I see again this week, Linos from Zimbabwe has joined us, asking questions about COVID-19, which is perfect. It's spot on for today. So the topic for today is around engaging during COVID-19. How are birthing persons, pregnant persons engaging with healthcare systems, finding the help that they need, or engaging with researchers and providers during COVID-2019. I would like for each of you to possibly share your challenges or best practices that you're having for engaging. And then those who are still able to stay with us, any questions they might have about engaging with others at a time where we cannot gather, but people have questions and need support more than ever before.
Okay, I guess Ruby and I are going to start again. This was a wonderful presentation, a really exciting project that just sort of reinforces the things that we see out in the field. We're case managers at Public Health, for anybody that doesn't know that. And we've had to switch to virtual visits. And there are positive things about it. We found that it is easier to get people who don't have to drive anywhere to see us. They appreciate not being able to leave their homes, but we are limited by that. You know, we've lost something, you know, in not having the face-to-face in the same room with somebody. but it looks like, this is the wave of the future. It's exciting work, especially the idea that there are wraparound services. It's not just the provider, that there are actually other people that will help meet other needs that the client may have. The technology thing, that's a concern to us because low income people have lower access and sometimes not the skills. We've struggled with Zoom a little bit ourselves, so we can relate to, which button do I push? How do I get on that link? And that sort of thing. So I think that's a challenge I see with this and any virtual project.
I love the name Glow. So keep growing, people.
Yeah, that picture was hard. It was
Yes.
beautiful.
Yes.
And I'll go next. So COVID has definitely been, I would say, a monkey wrench in our plans for 2020, but we have adjusted. We've moved all of our support groups online for those who needed them. But what we have learned is that engagement piece is surely missing, right? Folks are missing being able to just like get out of their homes and what that looks like. So we're creating a different type of COVID-friendly space to make that happen in 2021. I do believe that, of course, COVID's not going anywhere, but we do have the opportunity to adjust to what that looks like. My clients just, in general, speaking about the ones within the city, because we offer social support services, you can't do that from home, right? And so you still have to actually have that office engagement where they can come and get things with all precautions in play. But that's just where we are. As we move through what COVID looks like for all of us, there will still be that piece of engaging online because that's just it. But the in-person part is just going to be limited, but I think it's very, very necessary because I didn't see the change with our clients being able to come and like pick up items. I do see the change in their energy and how they are and how they present when we're in the group. So I can see that difference in the attitude and the body language, just full circle. And the first thing they mentioned is, yeah, it was great to see you when we came into the office or whatever that looks like. So that's always brought up in the groups if they were able to come into the office and pick something up. But I definitely think the online support groups that we've been doing all year is here to stay because then what it does allow us to do is offer our support group model on a national level because it is now available online. So that's the plus to it. I think for us, it's like we've been thriving in the midst of a pandemic, just kind of adjusting and making those needed changes that our client, we really listen to them. They give us the feedback, and what they continue to say for months and months is, when can I come into the office? So we've kind of, changed things to fit that just a little bit to give them a little something more of what they're needing right now.
So my follow-up question to that, because you said something intriguing. You said a COVID-friendly space in 2021. What is your vision around that? And so this is for Shades of Blue program
Yeah.
offered. Okay.
So we plan to open a new center in 2021, and we have taken the biggest space in our new space, and so that we can give that 6 feet of separation, but still be able to engage with each other. Of course, masks will still have to be in play, sanitizer and things like that. But that's really all we can do. I don't really, we can take temperatures, that's on the list. We can take temperatures, but really what the biggest picture to me is folks are starting to struggle on different levels, and part of that struggle is engagement. And so our support groups have always been in person. And so we're just trying to bring that back and adapt to our current climates. And it just means you're going to have to sit 6 feet apart from the person that's in your group. And that also means that our groups will be a lot smaller. They were already small. We didn't do over 12 folks. So now it'll be no more than 6. 6 is a comfortable number to still be able to engage in person. It's just adapting. That's just basically what we're doing.
Thank you, Kay. I'm not sure if our esteemed panelists have anything to add about new ways to engage during COVID-19. And I'll open it up too to the remaining attendees who have joined us from all over the world. How are you staying connected and how are you engaging with our populations during COVID-19?
I would echo some of what Kay has said. I'm a member of a mom's group, like a social and support group, Mother Center of Champaign County, and that starting in March switched to everything became online, whereas before everything had been in person. And I also work, this is separate from the mom and baby stuff, but I work for the Mindful Teacher Foundation, and we have developed, and before that, all of our training was in person, and we've developed online programs, which very similarly to Kay, we've found that for some people, this makes it easier for them to access. We've also been able to open up our geographic area from being solely our county to people all over the country. But there is that deeper connection that is hard to create online. There's something missing, I think, and I think people can feel that. I mean, I think everyone feels that.
I'm checking the chat box as people are saying they're just so impressed with virtual groups and being able to connect virtually. So, in terms of the barriers to accessing care, Glow has showed us a model. What are models that you're familiar with? I was looking to see if any of the attendees, such as Jennifer or Nicole, were still on the call, who recently experienced their own birth situation during the pandemic and had comments in the chat. But what are models of care that you're experiencing now? You can share the pros and the cons if you're willing. Mariah, I'm going to unmute you if you could share more with us. Let me go to you. Mariah?
Yes, can you hear me?
Yes.
Okay. Yeah, so I work for Nurse Family Partnership in Ohio, and we've been completely telehealth since March. So that's has a set of challenges, but it also has, I personally, I'm only first-time moms. We do have a pilot program that has multips, but it's worked for me because I have a lot of girls who are going back to school, they're in sports, so it kind of has been helpful in some ways. There's been a silver lining. And we have for our incentive, we have like a grant basically, and we're delivering diapers monthly to each client. So that's kind of been our retention incentive. It's like up to $50 per family, but that's only been since the pandemic.
So providing added supports to your clients and patients.
Correct.
Yes. Thanks, Mariah, for sharing that example.
Welcome.
Anyone else? Thank you, Jade. Are you able to share with your microphone?
Yeah, so this isn't a personal experience. However, my little sister just had her first baby, a little girl, in August. And I know that she was very upset that her husband, Robert, couldn't come to any of the appointments with her or, find out the gender of the baby at the ultrasound. She didn't have any I mean, he was able to be at the hospital with her and everything like that. So that was really wonderful that they could share that experience. But I know she was pretty upset, like doing this all herself as a first time mom, first time being pregnant, first time experiencing any of these things. And I also know she had a lot of trouble breastfeeding. Charlotte was tongue tied and lip tied. So without a proper diagnosis from a lactation consultant, you know, who deals with that stuff every single day, I know that she had a lot of issues breastfeeding. And that's one thing that like in-person lactation support groups can do. I know that personally because my son had a tongue tie and lip tie, and a lactation consultants diagnosed that, and we were able to get it revised. However, I know that those are just two of the things that she experienced that were difficult during COVID-19 for her.
Thank you for sharing that, Jade. And we have a response from Linos about the challenges in Zimbabwe during COVID-19. Linos, I'm going to unmute you if you could share with us. Linos?
Hello.
Hello. Hi.
Are you hearing me?
Yes, we hear you loud and clear. So you
It's
started to
okay.
describe your challenges during COVID-19. Please tell us more.
Yes, COVID-19 for sure brought a lot of challenges to our project, including the infrastructure, maybe to start with. Like, there were measures or recommendation to say we need social distancing, but if you have to look at the nature of the offices that we were using, on its own, it was a challenge to say how best we can, make proper social distancing among us as professionals so that we'll be able to deliver our services. So the infrastructure itself was a challenge. And we realized that, among us, the professionals, there were also in great need for information about the COVID-19. So, there was a lot of need to learn, from, the officers, the board of management, and also the executive committee to say, we all understand, or having proper information about the COVID-19. The issue of technology, when the lockdown started, we're not even prepared or having the proper technology now to reach our clients. So that was a multiple, challenges, for us as an organization to implement, our services. However, we started then to improvise, to think, outside the box, because of course we wanted to make mental health an essential service. So we had to, sit down as a team, and we introduced our mobile COVID-19 awareness campaign, where we now, reach the community using a mobile vehicle with our messages of, promoting and protecting, mental health during the COVID-19 pandemic. So this is one of the projects that we were like doing since the COVID-19 up to date. So we're reaching out to the communities with our messages, flyers, distribute them, encouraging members of the public to make sure that, they protect their, mental health during these trying times. So this is how we managed to make mental health an essential service. So I thank you.
That is wonderful. Are you able to speak about any of the perinatal mental health services that are provided to the clients that you're seeing in your society?
Definitely, what we do is we are based at a primary healthcare facility. So what we started to do is to make sure that we increase mental health literacy, because what we realize is that most people that still, interchangeably use mental health and mental illness, which then, increases a lot of stigma and discrimination, and also, gives a limitation of barriers in terms of mental health care utilization. So what we started to do is during the antenatal and the postnatal care visits, we take, we take the opportunity for the first 30 minutes to do mental health education. So we educate, the women in terms of, the importance of promoting mental health during, pregnancy and also after pregnancy. So that's how we started to engage women now, because of course the Ministry of Health and Childcare and the government opened the services, for anyone who wants, health services. They were coming at our local clinics. So we started now to do, like group mental health literacy, education.
That's wonderful. It sounds so much more advanced than how we are here in the United States in terms of our unequal access to perinatal mental health. I want to thank you all. I know there's more comments coming in the chat about just sharing and having this dialogue, this after-party dialogue about what we're seeing in our communities and how to stay connected on the topic of perinatal health during COVID-19 and make sure that we're all at the table. Patients, providers, researchers, payers, policymakers. So this has been so great to spend this time with you today. I want to remind you to please help us by completing the evaluation forms. You'll receive a link to the videos and evaluation very shortly in the next few days. Again, I want to thank our esteemed speakers, the Doctors Cooperman and Curry, for joining us today and spending their day with us, giving us insight into a successful PCORI project and how it's making real change and real impact on a very important community in California. So thank you all. With that being said, we'll go ahead and close. Look for the videos. Thank you for joining us. And there's one more conference coming up in April on perinatal mental health among rural women. So we're going to feature PCORI projects looking at perinatal mental health among rural women. So stay tuned. Thank you all.